Hi, my name is Denise. Do you know someone who has asthma condition? You ask yourself, what is asthma and how does it affect the body? As the frequency and severity of asthma continues to intensify, many families will encounter complex issues related to condition management and family coping. The nurse must recognize the impact that a chronic condition can have upon the family to assist parents in developing their ability to manage the child's care. My practicum course description focused on educating pediatric nurses of the importance of treating an asthma patient and recognizing asthma symptoms appropriately. This course will provide nurses with the knowledge needed to demonstrate and consistently maintain an approach analyzing the factors influence their practice in educating asthma patients and parents. The concept is to provide pediatric nurse a renewed understanding of asthma condition by developing effective strategies to manage and control the disease in alignment with the nursing standards within the scope of practice. The objectives: asthma teaching and learning knowledge. Asthma teaching: recognizing signs and symptoms of respiratory distress, prioritize needs of patients with breathing problems, managing and recognizing basic to complex asthma condition. Applied learned knowledge and competency in asthma care for patients. Learning knowledge, recognizing what asthma is and the factors that trigger asthma. Staff understanding educational needs of asthma management. A checklist sheet utilizing for each patient instruction for home care and establishing their needs at home for asthma management. Learning activities. By achieving staff participation and involvement in asthma management educational program, an educational asthma invitation was passed out. The invitation invite workers to come take part in having food and drink and participate in fun and exciting ways to learn how to better take care of our patient with asthma. Nurses plays an important role in care management. For this activity, asthma scenarios will be given along with four crayons, a yellow, a green, a blue, and a red, and a plain white paper. The staff will be encouraged to use the crayons according to match the severity of the symptoms with asthma condition mentioned. This will help in achieving the objectives of asthma learning by helping in managing and recognizing basic to complex asthma condition. Recognizing signs and symptoms of respiratory distress and prioritize needs of patients with a breathing problem. For this activity, everyone is a winner, but the person who uses the colored crayon matching the accurate asthma condition described by the narrator will receive a water cup. Completing this activity and using this simple list created by the staff step by step as a guide in managing patients with basic to complex asthma condition will, will assist the staff in providing optimal care for children with asthma. The assignment I have developed, the nurse will collectively develop and create a brochure created for target for kids and parents with information should a step-by-step release recognizing signs and symptoms of asthma attack and strategy planning and managing asthma flare-up. It will consist of an activity a parent can understand how their child is feeling when the asthma flare-up in simple terms in which a parent can understand. The description will go as follows. Get a straw and a cup of water. Close off one end of the straw. Place the closed end of the straw into the cup of water and try to blow. You will recognize you're not able to blow water into the cup of water. This is what a person suffering from asthma condition feels like when they are trying to take a breath during an asthma flare-up. The brochure will consist also of a list of instructions in what to do in the case of an asthma flare-up and its signs. Along with this, we'll have a questionnaire with questions such as regarding home care life, such as, does the home consist of dust and dust mites? Do your child sleep with the stuffed animals? If so, these are things in which can trigger an asthma flare-up, and suggestions will be given on how to manage them. Learning strategies. The need for developing knowledge in health profession has expressed great concern due to increased lack of detailed communication, poor use of coping resources, and the absence of inadequate support system. Is a leading indicator to incorporate the Institute of Medicine, the American Medical Association, into didactic educational practice will clarify the assessment and evaluate their thoughts and ideas. The concept is to provide the pediatric registered nurse to renew their understanding of asthma condition by developing effective strategies to control the disease. A comprehensive approach in nursing in clinical practice recognize awareness and treatments of critical factors and affecting children's health, even if these factors are not obvious to either nurse or parent. Identifying and listing factors that can trigger an asthma attack can aid in developing a comprehensive plan to ignite the visionary educational learning tool for the staff. From there, the staff can then use this knowledge to educate the patient and parents. I propose a strategy for change to collaborate with nursing staff to implement a comprehensive approach that will support the change process. This approach will generate a cascade effect, motivating and inspiring staff to apply their strength, knowledge, skills, and effort in working towards a common goal. Focusing on asthma educational project using 5 key elements to include inspire the shared vision, bring ideas to fusion, stimulating the scheme, modeling the way and enabling others to act, integrating into the curriculum and practice. Although some modest improvement made in presenting management of pediatric asthma into nursing curriculum and practice, studies conducted by the medical and nursing expert promote workshops such as recommendation and support from leading medical and nursing organizations relating to asthma health managing should be increased due to the incidence and severity of asthma as it continues to escalate. A primary strategy for integrating and managing a primary strategy for integrating managing for pediatric asthma into existing curricula is to develop and support a nurse champion leader who can take on a leadership role in educating the nursing staff to develop their knowledge needed to demonstrate and consistently maintain an approach analyzing factors, influence their practice in educating asthma patients and their parents. My philosophy is developing an asthma course of action that provides the staff with asthma management proposal to achieve optimal health. Nurse also encouraged to fill expanding roles and to master technology tools and information management system while collaborating and coordinating care across teams of health professionals. Social media based website programs can be very enlightening in providing an educational teaching learning tool for the nurse, patient, and parents. How many courses have you taken where the teacher and instructor stands in front of the room lecturing in a monotone voice and you fall asleep, bored? In today's society, there is more option to choose or pick from. How and where you want to view the material and collect the instruction in asthma home care. In response to these increasing demand, the Institute of Medicine Committee inspire nurses to achieve high level of education, suggesting that they educate in new ways that would better prepare them to meet the needs and demand of the population. The course outlines the appropriate content for asthma educational teaching consistent with the organization goal, implementing organization standards and abiding by the criteria to ignite learning technologies will effectively give meaning to the teaching approach in alignment with the organization mission, vision, and outcome, to control environmental triggers, and proper technique used to coordinate asthma self-management plans for children at the clinic, at home, and at school. Thank you.